Happy Wednesday, everyone. It's Michael McNutt, VP of Education and Marketing with WEDI, and welcome to the WEDI 2025 Spring Pre-Conference. This is our pre-conference content before our conference begins May 19th through the 22nd, also on Zoom. Right now, we are in the Inside WEDI Exploring Workgroups Zoom. Just a reminder, you can only access conference sessions and workgroup meetings next week through the Spring Conference HUVA site. Invitations have been sent. Another one will be sent Friday. Please feel free to sign in and you can access all the Zoom information through the agenda on HUVA. And once again, welcome to Inside WEDI, Exploring Workgroups. It's my pleasure to introduce Workgroup Leadership and WEDI Board Member, Pam Grose with PNC.
Thanks, Michael. Today we want to take a look at the different work groups that we have within WEDI. This is one of the main areas where WEDI can add value to our members by bringing together different stakeholders, focusing on different business processes, identifying challenges and best practices, and sharing that information with the industry. Our work groups, we have a very large variety of work groups, and they focus on collecting input, exchanging ideas, making recommendations, really looking at what is impacting our industry and how can we help resolve things that impact our industry or help provide information about what is impacting our industry. And again, our work group leadership committee, led by Mary Lee Stein, who is the WEDI board chair, and then myself and Tara Rose, who's also one of the co-chairs of work group leadership. And I do want to point out that participation in our work groups is a benefit for our WEDI members. And if your company is a WEDI member, then anybody from your company is eligible to join our work groups. And we certainly encourage you to reach out within your company and find people that fit within the different work groups that we have, so we can get additional participation in our work groups. Every perspective is valued, and every member is certainly has a great opportunity to share their perspective and give input into the different work products that we create. If you or someone from your company is interested in joining a work group, then contact Ariana Poole, and here's her email address. And if you're interested in becoming a WEDI member so that you can join a work group, contact Bill Alder, and here's his email address as well. So now next slide. This is a list of our work groups and those that we'll be presenting today. You can see we have a wide variety of business processes that we cover with our work groups. And so we want to give each of them an opportunity to share who they are, what they do, and what they're currently working on, so that you can take a look at that and determine, is there a topic here that you're interested in? Is there a work group that you're interested in participating in? And I'll point out that at the end, we're going to talk about a new work group that we're just forming that's focused on the patient experience around each of these business processes. So we'll talk about that at the end. So jumping in, I do want to point out, as Michael did earlier, we do have our spring conference next week, May 19th through the 22nd through Zoom. Our agenda is posted out at wedi.org, and a lot of really great topics that are available. So encourage everyone to take advantage of that as well. Now we'll jump into getting information from our work groups, and first is going to be our Acknowledgements subwork group. Neither one of these co-chairs was able to attend, so I'll be sharing their information. But the Acknowledgements subwork group focuses on the business processes and challenges related to acknowledgements, the workflow of acknowledgements, challenges around that business process. And they look at promoting the adoption of all the standard electronic acknowledgement transactions for providing a status of any submitted transactions. And they're not just focusing on one specific format of transactions, but rather a wide variety of acknowledgement options as well. Next slide, please. They're currently working on a Did You Know issue brief, looking at the 824 and expanding a previous issue brief around the 824 to include attachments, and looking at acknowledgements around e-prior authorization and identifying how acknowledgements fit into the EPA workflow, understanding fire, pass, or fail response messages, how the 999 implementation acknowledgement for healthcare and the 824 application reporting relates to a fire, pass, or fail response message, And they're looking at some potential fact sheets as well. Fact sheets are just single page, quick bursts of information. And they're looking at creating some of these around enhancements to acknowledgement transactions in version 8060. So what's new? And looking at both X12 and FHIR acknowledgements, the process for both, the standard differences and similarities around that. So a comparison between those. Next slide, please. This work group meets on the second Monday of each month at 3 p.m. Eastern. Their next meeting is Monday, June 9th at 3 p.m. Eastern. And if you're interested in joining, contact Ariana. Now we will move on to attachments. And Rose is on the line. So Rose, I'll turn it over to you.
Well, actually, Susan's going to start off, but thanks for that.
Oh, sure. I'm sorry. I didn't see that Susan had joined. So go
Yeah.
right ahead.
Yeah.
No problem at all. Thank you, guys. Again, I am going to discuss the attachments subwork group. Our co-chairs are myself, Susan Langford, and Rose Hodges that you just heard from, and Mary Lynn Bushman, and she was also unfortunately not able to attend today. But I'll go through this slide, and then Rose and I will switch off. From our work group overview, the purpose of the attachment subwork group is to focus primarily on the healthcare business processes and challenges related to the workflow for attachments. And we want to promote adoption of the electronic transactions for attachments, whether they be in X12 or in FHIR. And we want to educate the industry on attachments, provide possible implementation approaches, and to assist with the adoption of the new attachments final rule when that arrives. And we also want to address attachments, which will include claim attachments, prior authorization attachments, as well as other additional information needs. So the scope of our work group is, and our responsibilities are adhering, of course, to all of WEDI's policies and procedures, reporting up to the work group leadership monthly using the appropriate templates for that work group, and being technology and vendor solution agnostic, participating in WEDI's activities and providing input to CMS and HHS as appropriate. So our primary goals for the attachments are to provide a forum for all stakeholders to address, sorry, I have a pop-up message here blocking my view, for all stakeholders to address business issues related to the implementation and use of attachment transactions, provide educational guidance and best practices for issues related to the business processes and challenges of attachments, and provide feedback to the relevant SDOs as needed. So now I'll turn it over to Rose.
Thanks, Susan. So some recent work product that we have been working through the past few months is a white paper that's been out, I guess, probably at least a decade. It's the Attachment Collaboration Project, better known as ACP white paper. And what we're doing is trying to update it. And so it's being discussed, reviewed, and whatever changes we make would have to be approved by WEDI, X12, and HL7 work groups. And what we're currently working on, again, we will, and I think Susan brought this up too, there's going to be a final rule published for attachment at some point. So when that occurs, we will discuss implementation approaches, possible webinars and white papers, which would be helpful for the industry once that final rule is published. And again, we're going to continue creating an updated draft of the Attachment Collaboration Project white paper, which would have to be discussed, reviewed, and approved by WEDI, X12, and HL7. And I would imagine whenever we get a final rule, whatever information from that final rule would also be incorporated into that white paper. Next slide.
And as has been mentioned, our attachment subwork group meets on the third Wednesday of each month at 3 p.m. Eastern. And we would welcome any newcomers, and we have quite a robust group, and always are looking for new attendees and new input. So please join us. And if you're interested in joining, please contact Ariana Poole. Thank you.
Now we'll turn it over to the claims subwork group. We've got Stanley and Chuck. I didn't see Beth, but we've got Stanley and Chuck on the line.
Hey, it's Beth.
Oh, Beth is there too. Great.
Yes, from my mobile phone. And welcome everybody. Good morning, good evening. And the claims subwork group is widely viewed as the most popular and superior subwork group. And so we have a whole lot of fun.
Okay, I think we need to mute the line now.
So we do have a lot of fun in our work group, but in all seriousness, the claim is a huge transaction. There's a lot of challenges and still a lot of things to learn and create here. So our purpose is to provide a forum to discuss the claim transaction issues, especially around the business processes, the transactions themselves, the workflow. We promote adoption of use of the claim transactions, and we facilitate the implementation of common standards. We create white papers and provide educational guidance relevant to implementation and use of electronic claims. So lots and lots of fun stuff, a lot of scope, always something to talk about. Next slide, please. All right, so a couple of things that we have done recently is obviously contributing to the WEDI Conference Summit in Education. And we also collaborated with the Remittance subwork group to conduct a survey on the cost versus benefits for transitions to the next X12 standard from, I believe, 5010 up to 80-20, 80-30, I think. We analyzed and presented the results, and we concluded that overall the industry felt that moving to a new standard had a high value, but also a moderate to high cost. Next slide. Currently, we're working on a Claims 101 fact sheet. We feel that we found a need in the industry to be able to kind of explain the claim transaction workflow and a little bit about the claim transaction to like a basic kind of explanation. So we're working on this fact sheet that can be aggregated with the other transactions to give, say, new employees or people new to the industry, to give them a good quick study on the claim transaction, kind of how it's used, where it fits in the workflow. And we're also working on additional fact sheets featuring individual topics that cover major changes in the newest version of the 837. So we meet twice a month on the second and fourth Thursday of every month at 11 noon, and we hope that you'll join us. If you're interested in joining, just contact Ariana Poole. Thanks a lot.
Thanks, Beth. Now we'll turn it over to the claim status subwork group, and I know Gail is on the line.
Hello, yes, I am. Hi, thank you. James wasn't able to join. He's traveling today, so I'll work through our presentation. And I have to say that the claims are pretty important. If it weren't for them, we wouldn't exist. So we are a claim status subwork group. And our purpose is to, of course, primarily focus on the business process, and there are challenges related to the workflow when using solicited claim status. We really want to promote the adoption of solicited claim status transactions because we found the early approach to monitoring claims will help in the adjudication process, will help in bringing that cash in and making a financially sound revenue cycle. We want to help facilitate the implementation of electronic standards related to the solicited claim status transactions and provide a forum so that we can address these issues related, the challenges that we have, the defining the data that's coming back. We're working on creating help notes, white papers to provide educational guidance on the issues related to the use of electronic claim status transactions. The responsibilities of our subwork group is, of course, adhering to all the WEDI policies and procedures, reporting up through the work group to the leadership. And we want to help cultivate an agnostic technology and vendor solution environment. So working the the providers and the vendors together. Primary goal is, of course, to provide our forum for all stakeholders to address business issues and provide educational guidance and best practices. We found that there's a lot of questions on how to utilize the data coming back in enhanced claim status. So we're trying to give some direction and process for that. Next slide. Our recent work products were fairly new in ramping up. And so we're collaborating recently with CAQH organization. We have a gentleman that's going to be providing some input on the progress that CORE is making on potential operating rules for the 276, 277. And he'll be joining us on the 19th for our discussion. And we, of course, contribute to the WEDI Conference Summit and Education. Next slide. Also, we're currently working on the fact sheets. What is a healthcare solicited claim status transaction? Just an overall description of the business process and how that works in the electronic claim life cycle. And so I think that's really important to define and how important it is in the life cycle of a claim and collections of that claim. Next slide. And we meet, we have quite a few people who have joined already in our calls. We meet on the second Tuesday of every month. And if you are interested in listening in or participating, helping us create our white papers and our educational documents, please contact Ariana Poole.
Gail. Now I'll turn it over to Arna for dental.
Hi, everyone. My name is Arna Meyer, and I am the dental subwork group co-chair. And brief overview of what we do in dentistry, in the dental subwork group, is we provide a forum to address all the business use cases, which will be the claims transactions, eligibility transactions, claim statuses, remittance, and as it pertains to the dental industry specifically. So we focus on the unique requirements for dental providers, payers, and clearinghouses. And we've started to bring in our non-covered entities, our business associates, such as our practice management softwares, as they relate to all the federal regulations. So a few things we've been working on in the dental subwork group. The first thing that we highlight is our healthcare transactions used in dentistry fact sheet. There's quite a vacuum of educational resources for the dental industry around administrative transactions. And so we focused our attention for a good portion of last year, getting that out into the industry so that we've got a foundation to start building out additional resources. We also collaborated with the Privacy and Security Workgroup to put out some cybersecurity fact sheets, tips and fact sheets for small provider groups. And we've been collaborating with the American Dental Association to prepare the industry for administrative modifier use in dental claims. This is a new business process that is coming to dentistry starting July 1st. And so we're taking a proactive approach and providing our expertise to the American Dental Association to prepare the industry for that. And we're also participating in member position advisories to advocate for the dental industry specifically. And the most recent MPA was around the proposed rulemaking changes to the HIPAA security rule to strengthen cybersecurity for EPHI. What we're currently working on is, ideally, we're trying to make a case for the universal adoption of the 8060 implementation guide of X12. That's where a lot of the necessary standards that we need specifically for dentistry have been added. And so we're working on putting out some information surrounding that to make that case. We are also collaborating with the American Dental Association to continue to prepare the dental industry for administrative modifier uses in dental claims. And we're hosting working sessions for clearinghouses. We've started working with practice management softwares, and we're about ready to start educating the providers on these changes. We're also, we'll be participating in the CMS 0057 implementation update in June, from a dental perspective, and talking about current prior authorization adoption and where shortcomings may exist and where there's an opportunity for the dental industry specifically to start participating in those efforts. We do meet on the second Tuesday of the month at 1:30 Eastern, and we did have a short hiatus earlier in the year because I decided I wanted to go skiing and broke my arm, but we are back up and running with full speed now. And if there are any dental transactions or any dental considerations that you come across in your organizations, I'd highly encourage you to participate. We're looking for participation from clearinghouses, provider groups, practice management softwares, and the likes, electronic health record vendors, because the more people we get and the more diverse our group is, the better we will be prepared to keep up with medicine and have that interoperability that we really want. And so I encourage you all to come and join us and participate in the fun. Thanks.
Thanks, Harna. All right. Ready for Sandy? Are you on the line?
I am. Hi there. I'm
Great.
Dr. Sandy Rawls. Hi there. I'm the single chairperson for Genomics, but we're always looking for somebody to come join me. So, next slide, please. In the Genomics Workgroup, we're focusing primarily on the different healthcare business processes, the challenges, and also the data exchange that's related to genomics and healthcare and that workflow genomics. Genomics is kind of a special beast in that it's got additional players involved besides just providers, payers. It's also got labs and genetic counselors. So there's some interesting, unique features to genomics and healthcare and that data exchange. We're helping to promote the adoption of different electronic transactions and also work to educate different WEDI members around different aspects of genomics. And this is through subject matter expert presentations. So the scope of this work group so far, we've kind of relaunched about 9 months ago. But really to provide a forum for all stakeholders to address business issues related to the implementation and the use of genomic health information and transactions for improving patient care, and also to provide educational guidance and best practices for issues related to these different business processes and the unique challenges of genomics. Next slide, please. Recently we've had a couple different work projects. One of them was being part of the collective voice of the healthcare IT podcast. So episode 188 kind of talked a little bit about the genomics work group. So if you're interested in learning a little bit more about this work group, you should definitely listen to that. And we also provided a little bit of background around a group that we were bringing in for a presentation called Genomics. And Genomics is an HL7 subcommunity under the Codex Fire Accelerator. And we made some connections with them, and they came and gave a great presentation that was really focused on the strengthening and the enhancing of fire genomics through a specific fire clinical genomics implementation guide. They're looking at different scalable pilots to demonstrate the value of standardized exchange of genomic data between labs, the healthcare organizations, different vendors, and different clinical decision support tools. So they've become a great people that we've been able to collaborate with and hope to get some updates from them this year as well. Next slide. So currently we're working on another collaborative presentation, and this time it's internally with the privacy and the security work group. We're discussing genomic data privacy with something that impacts literally millions of people across our country, specifically looking at the direct-to-consumer testing, things like 23andMe. And this really came to head with the recent bankruptcy announcement by 23andMe. And so in our presentation, which is going to be this Monday from 12 to 1 Eastern, we're going to be talking about HIPAA versus consumer privacy laws, looking at different kinds of information that's collected and what could possibly happen to that data, and also what information the consumer should be aware of as it relates to their genomic privacy and security, and when to engage in this type of testing. So if you maybe have had your DNA tested by 23andMe or Ancestry.com, or you know somebody who has, and you're just interested from a consumer perspective, we'd welcome you to come join us on Monday. And next slide. We meet as a work group the second Thursday of each month from 1 to 2 Eastern. And we'd love for you to come and join, even if genomics is not your area of strength or background. You can come and listen and learn a little bit and hopefully contribute in some capacity. So thank you so much. If you're interested, just contact Ariana. Thank you.
Thank you. All right, I'll turn it over to Donna for eligibility and benefits.
Thank you, Pam. My name is Donna Campbell. I am a product manager at Healthcare Service Corporation, or otherwise known as Blue Cross Blue Shield of Illinois. My partner in crime is Amanda Abbott. She's part of Blue Cross Blue Shield of Kansas, and we both co-chair the Eligibility and Benefits Subwork Group. Our primary scope or objective for our work group is the same as everybody else's, making sure that we can get guidance and engagement for eligibility and benefit, not the X12 specific transactions, but in general, eligibility and benefits from an interaction and an engagement between payers, providers, clearinghouses, and vendors. We like to talk about in our work group, not just the X12 piece, but any of the business obstacles that people have that they run into. We like to provide 270, 271 specific conversation and then engage where necessary to make sure that we're working through business issues. We potentially may request changes to our standard development organizations such as X12 and give justification and business value ROI on those changes. We will definitely, anytime there's a regulation or an NPRM IFR that crosses paths with the eligibility and benefits space, we will review as a group and then potentially comment with WEDI. Our primary purpose and the most enriching thing that we do is come up with white papers, guidance papers, issue briefs, where we can talk to the industry about the industry problems and try to address some of the low-hanging fruit that can be done without too much strain on the payers, the providers, the clearinghouses, and the vendors. And then we continuously monitor the industry adoption and progress on the operating rules, not just the promulgation of them, but also the crafting and drafting of them from an individual organization, because a lot of our people in our sub-work group are in much of these organizations participating with different hats on. And so we kind of converge within WEDI to compare notes and make sure that we get and gain information and opinion. The next slide, what we're working on for our 2025 priorities. We've been, over the course of the couple years, entertaining topics of interest from our subwork group members, asking, what are some of those problems that we run into? And we have a list of things that we had looked at through a survey probably 2 years ago that we pitched out to people, and that coincided with another activity that we had, a survey that went out that asked, why are people still making phone calls when there's such an enormous volume of eligibility and benefit call inquiries out there, the 270, 271. And the information that came back from both of those surveys, one about what do we want to focus on, and two, why are we still getting so many phone calls coming through the systems with such a powerful transaction and such a large volume of inquiries and responses. And we decided as a work group that we needed to kind of scale back and tackle some of the preliminary things that were causing providers to call. So we published an issue brief about the tiered benefits, specifically how payers might be able to tap into some of the functionality that's in the 270, 271 to help providers understand where payers have tiered benefits. And now we're going to evolve into these next two items, which is one, the use of the prior authorization indicator that most people are aware of is EB11 on the 271, talking about when and where, what situation should you use it, how should you use it, is it required to be used, what happens if you need it, and a prior auth indicator comes back and says yes, and can you use the message segment for any information on that 271 to help guide and gear the provider. And a second topic that our work group is going to discuss this year which we were quite surprised was a hot issue, is the in and out of network determination. A lot of our members in our work group joined in a conversation a month or so ago, and we talked pretty deeply about how the in and out of network determination is imperative to providers determining potentially what tier they need to collect financials from the member, but also so they themselves can figure out if they're in this member's network, if they're not in this member's network based on their product that they have. And there was quite a bit of a stir, as I would call it, where there was the gamut, a lot of coverage in different situations where some were returning in and out of network, some were returning in network multiple times because of different tiers, but it wasn't clear which tier what in-network financial went with. So we're going to try to tackle that in 2025 to help streamline how to use the in and out of network indicator that to most people, is EV12, and then try to put a guidance paper out there on what's the best use cases and what are the best practices for current state, understanding that future state 270, 271 in different and newer versions that aren't yet ready for consumption, those are going to address it quite differently. And so we don't want to create a complete 180. So we're going to have to find a happy medium to try to steer the industry correctly without upsetting the apple cart in future terms. That's our work group in a nutshell. Our calls are every third Wednesday from 1 to 2 p.m. Central Time. We typically just round robin first with the work group and give everyone an opportunity to kind of help streamline what the topics or the agenda will be. And then if we have any prepared topics, we will move into that. Ariana, whose name has been dropped 6 times now, she's the person to contact if you'd like to get involved in our work group. And the next work group meeting may or may not be happening in, I think, next week, because next week is when the spring forum is. So I think Amanda may be leading it, but I'm not sure. So if we don't have it during the spring forum, we will have it in June. And again, it's the third Wednesday of every month at 1 p.m. Central. Thank you.
Thanks, Donna. All right, now I know Nick is on the line for our emerging technologies subwork group.
Yes. So good morning, good afternoon, everyone. Glad to be here. And so I am a fairly recent addition to the emerging technologies subwork group, but glad to be here. And I think it's public knowledge now that our illustrious leader, Ed Hafner, has officially retired. So he's going to be stepping back from the emerging technology subwork group. So next slide, please. All right, so emerging technologies is responsible for like future new business opportunities relating to stuff that's still out there a ways, including new standards such as FHIR or applications of artificial intelligence or new security technologies. In other words, things that we can't necessarily maybe apply today or just are starting to become viable, things that are maybe not quite fully standardized, but are maybe on the path to something that can be incorporated into standard, EDI or payer provider interoperability workflows. So next slide, please. All right, so most of what we do is host sessions where we bring in guest speakers from industry or standards groups or academia perhaps, and get them to present to the WEDI membership on various hot topics. And so some of what we've dealt with in the past has included, prior authorization pilots using new technology, AI pilot projects, usage of distributed streaming technology for more efficiently distributing information, all that sort of stuff. And so we're constantly on the lookout for interesting guest speakers, folks that can bring a new perspective to this work group and to everybody that participates. And so we, just to put a plug out that if you or anybody that you know is interested in possibly presenting in some area where you have some expertise, some new technology, doesn't have to be AI, but that we know that's kind of a hot area lately. So, if you or any of your colleagues are interested in coming to present, please get in touch with me or one of the other co-chairs, or Ariana again. She can put you in touch with us. We're always on the lookout for more guest speakers. Next slide, please. So we're currently, we're getting some more stuff in the pipeline to get about additional FHIR use cases, stuff for, again, payer-provider interoperability and value-based care. Also looking into some additional AI use cases, so stay tuned for that. Next slide. And meeting date time, sorry, that should have been on the slide there, but we do typically meet the third Thursday of each month from 3 to 4 p.m. Eastern time. And we generally only meet if we do have a guest speaker lined up. So we do sometimes miss a month or have out of cycle meetings, but generally it's going to be on the third Thursday of each month from 3 to 4 p.m. Eastern time. And sorry, before we wrap up there, just want to mention also we are on the lookout for an additional co-chair to join the team. So also if anybody is interested in that, it's a great opportunity to get involved. So thanks.
Thanks, Nick. Now I will turn it over to the No Surprises Act task group. I know we've got Stanley and Beth on the line.
Yeah, this is Stanley Nachemson, one of the co-chairs of the No Surprises Act task group. Happy to be here today, representing myself and the other two co-chairs of the group, Terry Cunningham from the American Hospital Association and Beth Davis from Veradigm, who you heard from earlier regarding claims. We were formed shortly after the passage of the No Surprises Act. And have been put together to review all of the legislative and regulatory requirements of that act and help the industry implement this set of very new requirements that was passed by Congress and is currently being implemented by CMS, HHS, and several other departments. Our group certainly adheres to all of the WEDI policy and procedures, and we want to make sure that we are cultivating an agnostic environment. There are a number of groups working on technical solutions, electronic transactions for the implementation of the No Surprises Act, the advanced explanation of benefits, and the good faith estimate. We certainly are allowing those groups to go ahead with their development. We are focusing on the policy issues and hoping to inform CMS and the departments about the right way to go ahead and implement this. We worked through our biweekly meetings, through calls, surveys, and have spent the last several years making recommendations for best practices and sending letters to CMS and the departments on WEDI recommendations for how best to implement the No Surprises Act. Next slide, please. We had one letter that talked about when to include diagnosis codes on good faith estimates and AEOBs for insured individuals. Another letter on the convening provider and facility issues regarding the No Surprises Act. And we are currently working on a issue brief and letter recommending a glide path implementation of the advanced EOB that's required but not yet implemented as part of the No Surprises Act. What we'd like to do is tell the departments that since this is such a important and very difficult and brand new implementation, we'd like to have the industry take their time and implement these requirements on a step-by-step basis so that we get experience in each of the types of implementations until we move on to the next one. That letter now has a series of about 5 recommendations. We're trying to gain acceptance of those and justify that, and we'll get that letter to the departments in the very near future. Next slide, please. We meet on the 2nd and 4th Friday at 1 o'clock. We are canceling next Friday's meeting because of the WEDI conference next week. So we will have our next meeting on the 2nd Friday in June. We invite you to join us to help advise the departments on how best to implement the No Surprises Act so it achieves the goals of letting patients know what their individual services will cost. So thank you very much. And if you're interested in joining, please contact Ariana.
Thanks, Stanley. All right, I believe we have Heather on the line to talk about prior authorization.
From the American Medical Association. I am one of the co-chairs for the prior authorization subwork group, along with Janice Bakos from Aetna, Dave Delano from Nitin, and Raj Gadavarthi from MCG. I think I'm the only one of us on the line right now. I think Janice might be joining a little later. I don't know if she'll catch us before I'm done speaking. But as you've heard from several of the other co-chairs of the other subwork groups, we focus on workflows and business processes first and foremost. And in our case, we're looking at the prior authorization process, both from the provider and health plan perspective. And we also certainly pay attention to the role of vendors and intermediaries in this process as well. We identify pain points and challenges related to prior authorization, specifically prior authorization automation, with I think a North Star of examining how this process can delay patients' access to timely care and finding ways to reduce care delays. We develop recommendations and guidance on how the process can be improved via automation and to reduce administrative burdens across all stakeholder groups. And ultimately, we are looking to promote a standardized end-to-end automated process for prior authorization. Certainly, historically, in the past, we've been looking at the X12-278, the HIPAA mandated transaction for the process. And then more recently, certainly in the current regulatory environment, we've been looking at the FHIR APIs that have been mandated under the CMS 0057 final rule to support the prior authorization process. So we provide a forum for all stakeholder groups to come together to evaluate business processes and challenges. And we've developed several pieces of educational guidance over the course of our subwork group's existence to help the industry in implementing an end-to-end electronic prior authorization workflow. And then we also certainly serve as a resource to WEDI's leadership in providing input in CMS, HHS recommendations on electronic prior authorization. Next slide, please. So a couple of our more recent work products include a podcast that several of the co-chairs recorded last summer. And then more recently, we've been participating in an ongoing WEDI Spotlight series on the CMS 0057 interoperability and prior authorization final rule. Encourage folks, if you're interested, to join us for the next one, which is on June 11th, which is going to be an event focusing on implementation of the FHIR APIs for prior authorization, specifically looking at this from the provider and EHR vendor perspective. And then also we recently completed, and certainly must give a huge shout out to Rob Tennant for his huge amount of work and effort on fielding a prior authorization implementation survey with the results that were recently made available. We've been looking at those results and concerning what kind of guidance and assistance we can offer to the industry to address the challenges identified in those survey results. In our most recent discussion, we were talking about possibly coming up with some videos related to implementation or a set of FAQs that providers could use in discussing implementation of the APIs with their EHR vendors. Next slide, please. I think I might have just talked through these. Yeah. So that's kind of what we're working on now. Again, I encourage folks to come to our work group meetings as we kind of hone in on what might be the most helpful things for us to offer to the industry as we move forward with implementing the FHIR APIs for electronic prior authorization. We meet the third Tuesday of every month at 2 p.m. Eastern. Our next call will be on June 17th. That's our next regular scheduled call. Again, I think we're taking a hiatus next week because of the conference, although we might sneak in still on Monday and have a kind of brief sub-work group overview and review the WEDI survey results. And again, Ariana is the person of the hour. If you have questions or are interested in joining us, please reach out to Ariana. And that's it. Thanks a lot, Pam.
Thanks, Heather. All right, jumping into privacy and security, I believe that Leslie had to drop. So Rob Tennant will present the privacy and security information.
I appreciate that, Pam. And yeah, so we've got a very vibrant work group focused on privacy and security issues. It's led by Leslie Burkeheiser from Direct Trust and Tan Tian Wen from Kaiser Permanente. And so this work group is very active. They focus on offering implementation guidance on current and future privacy, security, and cybersecurity related rules and regulations. And so, for example, they helped out during our development of WEDI's response to the cybersecurity regulation released by the Office for Civil Rights. They obviously promote practical and appropriate approaches to compliance and business operations. So they put out fact sheets, and they've been working on things like developing best practices for APIs, which I think is a very timely issue today. In terms of the scope, the responsibilities of the workgroup includes reporting to workgroup leadership meetings, being technology and vendor solution agnostic, and they're very active in our various spotlights and conferences, both Tan Tian and lastly present at our events. And again, one of our goals of the work group is to really give participants a good sense of what is going on in the privacy and security environment. And rest assured, there's always new information. So certainly encourage you to get involved. What we don't do, we don't interpret any of the specifications of the transactions or operating rules. And we're not looking at privacy and security issues that are not within the healthcare realm. I will note that on occasion, the work group will work in tandem with other work groups or sub work groups. So, for example, we worked closely with Arna's group, the dental sub work group, and of course, as you heard from Dr. Rolf, we're working with Genomics specifically on the issue of the 23andMe bankruptcy and the implications that has on genomic data. Just to give you a sense of some of the recent work products, the work group produced the cybersecurity do's and don'ts, which were really an excellent overview of some of the things that all organizations should be considering. We had a wonderful opportunity to bring in Tim Noonan, who is the deputy director at the Office for Civil Rights, to talk to the work group. And I expect that the work group will be bringing in some folks from the new administration as soon as they're able to come and speak, because we absolutely want to hear from the new administration on some of these critical privacy and security issues. And as I mentioned, they were the co-chairs were facilitators at our member position advisory meeting back in March on the HIPAA security rule. Next slide. And as I mentioned, they're currently working on the 23andMe bankruptcy issue. We're looking at doing some tabletop exercises going forward. And there's always emerging issues, one of them being identity issues. So we're going to be looking at that as well. And finding opportunities to enhance patient trust in healthcare transactions. Next slide. And just as a reminder, the work group meets once a month on the second Wednesday from 2 to 3 Eastern time. And as you've heard many times before, if you're interested in getting involved in this work group, or if you have a colleague that has privacy and security in their portfolio, please reach out to the one and only Ariana, and we'll get you signed up. With that, thank you, Pam.
Thanks, Rob. And so I'll turn it over to Sherry to talk about property and casualty.
Thank you, Pam. I'm Sherry Wilson, and I co-chair the Property and Casualty e-bill sub-work group with Tina Green. And we'll go to the next slide. Just very quickly, I'd like to just give you a quick summary of the background of the origin and purpose of this work group. As many of you know, property and casualty represents workers' compensation and auto industry lines of business. It's a legal system, extremely paper intense, with 50 states all having different regulations. So we found as states are moving towards automating medical billing and payment processing, they realized to achieve the stakeholder adoption, they really needed to align with the HIPAA EDI national standards. So one of the goals in this work group is to achieve this objective. Stakeholders came together. They represent in our work group states, state regulatory agencies, providers, payers, third-party vendors, clearinghouses, and we all came together to collaboratively support this initiative. And one of the things we realized from an industry business need point of view is that we needed a single national property and casualty resource reference center. There is no place to go where you can go one source to be able to see what the current property and casualty regulations are around electronic medical and billing. And this is where WEDI came in. And what WEDI did is they created this sub-work group to provide a forum for the property and casualty community to come together to address our business needs, our challenges, and to be able to provide industry resources and guidance to help assist the industry in moving towards EDI automation. And part of the process in this work group to achieve that is we've done, as other work groups have referenced, through white papers, through webinars and information forum. So if you're interested in property and casualty and staying informed on state e-bill regulations and the opportunity to participate in stakeholder collaboration efforts to further this initiative, this is a great work group to join. I'm putting that out front because we really strongly have a great group of people and shareholders that are participating in this group. So we go to the next slide. Real quickly, I'd like to share with you our 2025, some of the agenda items. One is property and casualty is working on looking how to automate prior authorization. Today, most all treatment requires authorization, and most of it's done through fax and email. So one of the great things states have brought forward this business need, looking at how do we begin to approach and consolidate to have a national standard towards prior authorization. And again, we look at the 278, we look at, FHIR and APIs. So one of the projects we're working on is actually drafting a state survey and stakeholder stake survey to identify the business needs and challenges in EDI readiness, and opportunity to look where we can leverage, again, existing regulations and technology solutions, keeping in mind that stakeholders, they're the same providers, often the same payers and same third-party vendors. So it's a natural transition. So we're working to consolidate that. So that's very exciting. The other one that we're working on is property and casualty. It's a white paper which provides guidance on the use of CARC and Workgroup combinations in the industry. This we are working on updating. This has been a great resource tool, especially for states that are moving to adopt e-bill regulations, to take those state proprietary codes that may have up to 1,000, and payers sometimes have up to 3,000 plus. The ability to use this tool to be able to identify the business scenarios in which the CARC codes are used really helps, again, to be able to migrate from proprietary codes to the national code set. Very similar to the CAQH core business use case. Great resource, a great opportunity to participate in this effort. The third, if you check next slide, real quick, again, that national one-stop shop with WEDI, a resource center. We're updating as a living document our PNC summary of e-bill state regulations. That is posted. We provide the link below to our community website there on WEDI. And their new regulations will be updating, such as Colorado, that has e-bill regulations starting January 1, 2026, and also the New York electronic e-bill mandates that are effective April 1st. So great opportunity to have that as a resource. And also we're shooting for September for a WEDI Property and Casualty podcast to highlight our 2025 industry regulations and state efforts in those initiatives. And of course, ongoing topics and informational forums and discussions regarding new regulations and standards and best practices. Next slide, please. We meet the first Thursday at 2 o'clock Eastern Time. Again, if you're interested in knowing more about property and casualty or participating in these efforts to help automate EDI efforts across from an industry and statewide perspective, please contact Ariana for information on how to join. Thank you.
Thanks, Sherry. And now I will turn it over to Michelle for our provider information subwork group. Michelle, are you on the line? And I don't believe I saw Martin. I did see Michelle.
She is on. I've asked her to unmute.
Hello.
Hello.
Good afternoon, everyone. I'm Michelle Berry. I am with Ability. I'm the co-chair along with Martin Cody, who is with Medicat Health. I'm with Ability with co-chairing Provider Information Subwork Group. Apologize for the noise in the background. I'm trying to find a quiet place to present. So Pam, if you could go to the next slide, or team, we could go to the next slide. Couple of things we wanted to bring to everybody's attention from a provider information perspective. Provider information affects every type of transaction in healthcare, whether it's vision, dental, healthcare, property and casualty, it's auto, it's every type of provider engagement with that journey with a particular patient, beneficiary, etc. So again, our focus around provider information is really engaging the business aspects of provider data. So as we continue to talk about more about the purpose and scope, we would love to have you and team join us. We meet once a month and we'll get into that here in just a minute. Again, creating materials that are universally utilized and effectively educating individuals within the healthcare, vision, dental, and other areas and sectors of the industry. We also talk about use cases that are specific to provider data. Our North Star is really focusing on patient quality outcomes with the right provider at the right time for the right reason. We do know that some patients aren't able to select their particular provider in advance of a particular procedure or service, but the option there is to ensure the patient is getting to the right provider. So if an individual is looking for a provider in a geographic location, we've got those use cases already formulated so that we are really focusing on, again, our North Star is the patient. Conducting webinars and work group sessions are super important to us because communication is everything that we do. So if you look back on our meeting minutes and our actual folder in the WEDI.org, that contains a lot of information that we've provided since 2018 when we were voted in. Standing room only. Rob remembers we had standing room only providers, health plans, payers, and vendors alike driving this particular need for this work group to be established. So again, it's not just about providers and provider data. We also encompass and work closely with our health plans, payers, vendors, clearinghouses, trading partners, and other entities, stakeholders in the industry. Our scoped items is really to bring the real live use cases to life in suggestions, whether that be a podcast, which is coming up Monday, putting a plug in there. If you're interested in joining our podcast at 10 a.m., we highly recommend you joining us for that session. Think that you're going to be pretty happy with the way we're going to be communicating some super important information. With that said, looking at some additional information, again, we meet monthly. So keep in mind, come together. This is all of us in our industry coming together and talking about provider information. And what are those pain points? What are we seeing that's not working? What do we see that's working well? And how we can effectively ensure the patient's quality outcome with the right provider at the right time for the right reasons. So again, keep that in mind. Also, we are doing an MPA this Friday. So if you're interested in joining that MPA, again, Ariana is our go-to, again, for our educational sessions and information sharing sessions and even registering for a provider information sub-work group. Collectively, if we can go to the next page, here's our dashboard feature. This dashboard gives you a 50,000-foot level look at what we're doing, where we're at in that scoped effort, where we're trying to go, and some timeframes that really drive to some of the deliverables. So as you can see here, 2025 is pretty detailed, and with the details, we also have some additional opportunities in the industry as well, and on demand. So if you think about as we're changing our federal and some state regulatory and even local regulatory requirements, we are engaging with the industry. So we could be prompted to join a session in a couple hours, a couple of weeks. So again, keep your eye on the provider information sub-work group dashboard because we're continuing to grow. It's not just about provider directories, we're provider information. That includes contracting, networking, credentialing, and really pretty much everything else like a claim, authorization, anything else that provider data is utilized for care of an individual patient, beneficiary, subscriber, or dependent. So if you could go to the next page, Pam. Currently, what we're doing and working on some major activities is engaging with other industry knowledge base. That could be Gravity, HL7, Social Determinants of Health. Gravity is Social Determinants of Health, Organization, Gender Harmony, and focusing on bringing these experts to a panel discussion around provider information. That looks like YouTube videos, podcast, educational forums, in addition to the panel discussions. And again, as we stated, focusing on everything provider information, directories, contracting, networking, credentialing, provider enrollment, reporting capabilities. Forgot to add that earlier into our dashboard, but keeping those reporting capabilities alive and very well in tune with federal, state, and local level requirements. A couple of other things, again, we've got additional information coming out, as we all know. The spring WEDI session is next week. Please join us. The work group meeting is on the 19th. We're going to be presenting again. Come join us. We are actually kicking off a podcast during that session on the 19th at 10 a.m. The next slide gives us a little bit more constructive details about our provider information subwork group meetings. And we do meet every month. And keep in mind, because this next week's meeting is really focused on the WEDI spring session, we moved our meeting to the 19th. So we're officially having our May meeting, May 19th at 10 a.m. And then June 19th, a majority of our organizations are participating in the observance of Juneteenth. So we are not meeting June 19th, but we are meeting in July again. So come join us. We're looking forward to having you participate with us. And Ariana is your point of contact. Any questions that you have, feel free to reach out to her. Her email address is listed below. Pam, I'll turn it back over to you.
Thanks, Michelle. All right, next we'll go into the Remittance Advice and Payments Subwork Group. I'm one of the co-chairs of that group along with Pat Wietek from Cognizant. So next slide, please. Our work group, as the title says, we focus on business processes that are all around the remittance advice along with the payment. So we look at EFT issues along with remittance advice issues, business processes, challenges related to those, and look at what we can do to promote adoption of electronic transactions for both of those functions, remittance advice and payments. So next slide, please. Our work group has been spending a lot of time looking at a series of fact sheets that we've been created. And as I mentioned earlier, fact sheets are kind of a one-page quick burst of information. And we've been looking at what we can produce around these, looking at some of the major enhancements that have been made to the 835 transaction in the newer versions. So I'm going to turn it over to Pat, and she's going to talk about some of what we've done around that.
Hi, thanks, Pam. So the fact sheets are a joint effort with X12. We're working with the assigned subject matter experts as our sub-work group here at WEDI builds out the information. It includes, you know, what changed and what are the benefits, and then the kinds of things that the different entities across our industry need to consider related to that particular change. And, you know, the impacts, you know, change a database or change reports or things like that. So we're working together with X12. So as we're publishing the fact sheets, you'll see that they have a joint logo on them. So realizing that we've kind of collaborated with the data and the content in these sheets. We looked at, you know, what are the key heavy hit changes that were done in the future versions of the 835 post 5010. You can see this list here. I'm not going to read everything. There, you know, the RAS segment is huge. That replaces the old CAS segment. The remark codes are external. Some additional guidance on how to populate the data in the 835 has been a lot of great improvement in those different sections. Next page, please. Continuing down, you'll see that we're currently working on a few of these now with X12, and you know, there's different review points along the way. The latest one that we're starting to tackle has to do with testing overall in the new version. So what is that going to look like? What are the kinds of things that need to be considered. We break it out by clearinghouses, the provider, the vendor systems, and payers, right? So we've kind of taken this and what will each of those entities have to think about? It's not going to be a detailed test plan by any means, but more of, hey, these are the things you don't want to forget or overlook. The final piece is once it is all approved, they are published on the WEDI website under, I forget exactly the link. Pam, do you remember the link?
They're in the Knowledge Center at wedi.org. If you go to the
go.
Knowledge Center, yes.
Okay, thank you. So everyone's welcome to take a peek. They're free. You know, you don't have to necessarily be a WE member to be able to look at those. So please take some time. Hopefully you'll enjoy them. And as you can see, these are a lot of more topics that we're going to continue to work through as identifying what has changed in the 835. And Pam, I'll hand it back to you.
Thanks. Next slide, please. And yeah, so we encourage everyone to join our group. We have a really good group that attends pretty regularly, but we are always looking for new members to give us new perspectives. We want to get everybody's input as we're looking at this kind of information and make sure that we're looking at the fact sheets include things like what are the benefits of this change, what are the impacts of this change, and we want to make sure we have complete information about that from all of the different stakeholders. So encourage everyone to attend and give your input there. We meet the first and third Monday of each month at 11 Eastern. So please join us. So next slide, please.
Yeah, and we're actually well, let me just add, Pam, we're actually meeting this coming Monday, the 19th, as part of the WEDI conference. So everyone can join us. You don't have to be a current member to participate and listen in, see if it's something you're interested in. And then maybe you could join us.
All right, I'll turn it over to Michael for value-based care.
Great. Thank you, Pam, and thank you everybody for your time. So we've just celebrated our 10-year anniversary for this work group, right? So our work group's charter and our objective is to advise and educate all stakeholders from payers, providers, vendors, software development organizations on the recent and new value-based care payment models. We usually have the task of moderating sessions during conferences, WEDI conferences, with the CMS Innovation Center, HCP LAN, which is the Healthcare Payment Learning and Action Network that moderates and monitors the transition from fee-for-service to value-based care in the healthcare industry. We have a very tight alignment with CAQH Core, HL7 Da Vinci, and we've collaborated together to make sure that our terminology, our vocabulary is similar, so we're not spreading different types of terminology out there. CAQH Core just produced a very impressive definitions listing that we've reviewed multiple times on the value-based care work group. Additionally, if you can go to the next slide, we've had some great speakers, some guest speakers. Oh, well, that's me. I'm on the board of directors at WEDI. I work with CAQH on their value-based payment advisory board, and I write articles. You can go to the next slide. So again, we've had some really great guest speakers. Even before Lynn came on, we've had folks from ACOs that have come on and discussed how they're interacting with CMS and CMMI or the Innovation Center, new payment models like ACO Reach. Lynn came on and was discussing how his organization, and he had presented previously at WEDI conference, and I wanted to have him on as a guest speaker, and he spoke to a lot of the new innovative specialist payment models that are going out there, right? So a lot of the past decade has been focused on primary care providers and providing quality care and being the quarterback for all, transitions of care and coordination of care. We're now moving into a new world of where we're bringing in specialists. So Lynn was a great view into that. That was a great month for the value-based care model. The next slide, last month we had Gary Singh from Edifex. I'm from Edifex too, so but he works directly with Edifex value-based contracting solution and the AI-powered capabilities, and he's written a number of great articles over the past year on how AI is really infiltrating and assisting in the transition from value-based care, in the transition to value-based care. I'm hoping to promote him even further. I think he would be a great add to the co-chairs of the emerging technology, so I'll be attending to that after this meeting. But Gary was very informative on how AI is affecting the transition, not just the transition to value-based care, but the transparency that's provided downstream to the providers. That has been really, slowing down that transition. So it was a great session. And just to promote, it's going to be promoted a little bit more, but we have another guest speaker in June from a payer, a very a large blue payer from the East Coast. Don't want to give too much away, but they'll be talking about real world implementation of value-based care contracts and how they're working with their provider networks to make sure that the transition from fee-for-service to value-based care is going on. Next slide, please. So as I mentioned, we've also, we moderate many sessions within the conferences of WEDI. The WEDI staff has been amazing getting the CMI Innovation Center directors and deputy directors, and the value-based care work group has been, fortunate to be able to moderate those sessions and flush out, what the direction of CMMI, the Innovation Center, is looking at, whether it's a new or modifying an existing payment model. We've also had the opportunity to moderate sessions with HCP LAN. Again, that is the Healthcare Payment Learning and Action Network. It's now folded under the CMS website, as we found out on last month's work group meeting, that there seems to be a transition from being a standalone site, that it's now incorporated with the CMS website. So that was interesting. But what we're doing is we're tracking the goals, right? So the goal for the federal government, right? The goal for at least, any Medicare, Medicare Advantage, Medicaid, ACA is to move to the value-based care models. And you can see very aggressive for Medicare Advantage and traditional Medicare at 100% this year, and then 50% across commercial and Medicaid. I think commercial, just from my experience over the past decade, they're probably a little higher, just not reporting it as publicly as the other government type plans are. But yeah, and thank you, Christine. We are actually pretty close to that. In fact, I think on the Medicaid side, it depends what plan, what national plan or what regional plan is reporting to HCP LAN. But yeah, we'll see with the transition to the CMS website. We'll see how that transparency, they usually put out an annual report showcasing the lines of business and how their reporting has transitioned to value-based care contracts. But I can speak to my clients that I work with every day. I think Medicaid is one of their biggest lines of business. So really good work being done at the Medicaid level. There's also CMS initiatives on DSNP that are really being pushed at certain state levels and will then populate throughout the nation. And then with the new administration coming in, there seems to be a new or renewed focus on bringing the patient, the member, their health experience, and bringing them in as a stakeholder. Right now, if I was to generally categorize value-based care contracts, it was between payers and providers. But you're really forgetting the most important person who can affect the most change, and that is the patient, the member. So I think, and I'm hoping, just in reading recent weeks of articles, that there'll be some push to bring in that third leg of the stool, so maybe some value-based contracting initiatives for health plans. I know it's been around. It's called, what was it called? Value-based insurance design, VBID, where the member is empowered to change their health, their trajectory on, heading towards diseases. So we'll see what's going to move forward, and that's what our work group works on. Next slide, and I'll wrap up. So we meet every fourth Tuesday of the month from 3 to 4 p.m. And again, MVP at WEDI, and everybody's an MVP at WEDI. But Ariana, if you want to sign up and get an invitation to our monthly work group, please reach out to Ariana. Thank you, Pam.
Cool. As I mentioned earlier, we have a new work group that's just being formed that we wanted to let everybody know about and see if you're interested in this. So we have just recently formed a work group focused on the patient experience. So let's talk about that a little bit and what is that going to look like. Next slide, please. Again, it's just being formed. The focus here is on the patient experience as we implement all of these other things that we've talked about, as we implement new standards, new regulations, new processes. What is the patient experience as we look at all of those things? So some of the topics that this work group might focus on are the No Surprises Act, the API rule that we have, and potentially creating some sample language to educate patients on how these APIs might benefit them. TEFCA, impact to patients, HIEs, e-prior auth. Why does it take so long to get an appointment? Looking at things like making sure the patient understands there are things like eligibility checks that have to be done, prior authorization, all of these upfront processes that have to take place that might make it take a long time to get an appointment. Not looking at things like what kind of patient registration system is best. That's not really WEDI's area, but looking at some of these other upfront processes and how that might impact time that it takes to get an appointment. Looking at cost estimation and cost transparency, provider directory information, selecting doctors, how to read an EOB, doing some education there, how to make payments, the clipboard experience, and what are your rights as a patient. Those are just some suggested topics that we had thought of as we were looking at forming the work group. And as the work group starts coalescing and moving forward, they'll take a look at these, potentially start with some of them, or may have some of their own that they think are an even higher priority to start with. But these were the ideas that we had as we were looking at forming the work group. Next slide, please. We want to make sure that all of our stakeholders are involved in the work group. So obviously patient advocacy groups we want to have involved because we're looking at the patient experience, but it really goes beyond that. We want to make sure that payers are involved, that providers are involved. Obviously providers are the ones that have the relationship with the patients. Payers are the ones that directly impact the patient's experience. Even clearinghouses and vendors can potentially have an impact to the patient experience. So we want to make sure that all of our stakeholders are involved in the work group and that we get all of those perspectives brought in as we look at some of these topics that this work group will be engaging in. Next slide, please. So our next steps around bringing together the new work group, we need to identify co-chairs. We have 2 potential co-chairs that are currently going through the approval process, and we need some more. And then once we get our co-chairs in place, we'll get the work group kicked off. They'll set a meeting time in place and create a charter. So really helping put the guardrails around the work group. So if you think that you or someone in your organization might be interested in participating in this work group, as we've all said, contact Ariana, but we will make sure that you are aware when this work group gets up and going and establishes their meeting date and time. So again, just want to remind everybody that the WEDI Spring Conference is next week. I do want to let everybody know that we have some of our work groups have special meetings that have been scheduled on Monday, the 19th, that are open to all of the conference attendees and non-attendees. So anybody can attend these work group meetings. And here listed on the screen are the work groups that are holding special meetings. And you can look at the conference agenda to determine when each of these work groups is meeting, but it gives you an opportunity now that you've kind of gotten a taste from each of the work groups on what they're about and the kind of things that they're working on. Maybe there's some that really piqued your interest that you want to get a little bit more information about. This is an opportunity to do that. You can attend one of their work group meetings and really get more down in the weeds on what's happening. How does the work group function? What's the feeling and the interaction between the attendees? So it's a great opportunity to really understand, is this something I want to continue to participate in? So again, those are Monday the 19th, and then the rest of our spring conference is the 20th through the 22nd. And I also wanted to remind everybody that the work products that all the work groups talked about, I put this in the chat, but the work products are available at wedi.org in the Knowledge Center. We mentioned that earlier as well. And information about the work groups. If there is a work group that you're really interested in attending, you can go to wedi.org and get more information about the work groups there as well, including the dates and times that they meet. So if you are interested in that, you can get more information at wedi.org, and you can contact Ariana as well.
Thank you,
So,
Pam.
Michael, yeah, I'll
Go
turn it
ahead.
back to you. No, I'll turn it back to you.
Our final session takes place at 2:45 Eastern. HIPAA exception pilot proves significant improvement how using file APIs streamline prior authorization. This is a separate link. It's not the same link that you're sitting on right now. So we look forward to seeing you for the final session starting at 2:45 p.m. Check your email, or if you have access to the HUVA site, the link is in the HUVA site under community. Thank you very much to all our co-chairs for a fantastic presentation.